Today we tackled the question that a lot of people have wondered. When do you go to the ER and when is it just an urgent care issue? It's honestly kind of a nuanced thing to think about, and that's exactly what we're talking about today. I'm Sarah King, and I have a lot of questions. Hormone replacement therapy. Will that increase your desire to want to have sex? You gotta get that protein. Get that protein. Ladies, you need the protein. Do you think it's been exaggerated? If I have sex the night before my pap smear, can it mess up my results? In this show, I get to ask WakeMed doctors any question I want, and bless their hearts, they have all the answers. Sarah Has Questions is a production of Mix 101.5 and Capital Broadcasting Company, and it's presented by WakeMed. We always wonder when you get hurt, is this bad enough to go to the ER or should I just go to urgent care? Well, we're tackling that subject today, and I've got Dr. Graham Snyder with me today. You're an ER doctor.
I am indeed.
Wow. That is quite the circus you work in.
It is. It is very exciting, wonderful, scary, terrifying, and comforting. It's everything that you can imagine and many things you can't.
Yeah, I bet. Well, as much as I want to pick your brain about what goes on in the ER that I don't know about, which is not the pod, we'll do another podcast on that another day. We're going to talk about and stay on subject, whether or not you should go to the ER, the urgent care, orthopedic urgent care, possibly just a regular doctor's appointment, because you never know. So I have a long list that we're going to kind of rapid fire through.
Okay.
But first of all, really, what is the difference, the big difference between an urgent care versus an ER?
Probably the most fundamental difference is the access to advanced imaging, laboratory tests, surgery, consultants. So when things go badly, if you are to get critically ill, then the emergency department can provide vast numbers of things that an urgent care cannot. However, urgent care's got great potential and can take care of the majority of minor injuries.
You got
injuries.
This. There you go.
Thank you.
We all do it.
Except speech impediment. But if things go badly, then the emergency room is where you want to be.
Okay. Well, let's get to this list because it's kind of long. Okay.
Okay.
All right. So I'm just going to start naming them off, and I think
Sure.
the best way to tackle it is like, do this. If this happens, go here, and if this happens, go here. Maybe that's how you should tackle it.
I can try.
Okay.
There's some subtleties.
Oh, okay. Well, let's just get started. Cuts. How am I going to know if a cut is bad enough to go to an ER versus an urgent care?
Yes. So any cut where there is uncontrolled bleeding. So you put a little Band-Aid, a little cloth on there, and the bleeding doesn't stop, absolutely that has to be in the emergency room.
Okay.
Any bleeding where it's pulsing, so you see like a squirt.
Like a heartbeat?
Squirt, yeah.
Yeah.
If you see that,
Whoa.
that's an artery or an arterial, that needs to be in the emergency department.
Okay.
And then, this is somewhat subtle, but the practicalities of fixing it. Imagine it's if it's me and I've got a 2-inch cut on my face, then most urgent cares could fix it. But what if I'm a year and a half old and I have a 2-inch? That kid's going to be wild and screaming and thrashing around,
Right.
and we'll need sedation and multiple hands and things to hold on him. So that's likely something that would need to go to the
I
emergency
hadn't even
department.
thought about that.
This is going to require some judgment.
Yeah.
But if the wound is disfiguring, meaning it's changing the contour of a person's face, or the hand is ragged, that very well need advanced surgical techniques. And any wound that causes dysfunction. So you've got a cut in your hand, and then you can't move your finger.
Something else has happened. Yeah.
Exactly.
All right. This one hits close to home for a lot of people. High temperature in a young child.
Yeah, so that depends on the age, and it depends on how the child is acting. So once you get down below around 2-3 months, that's more of a danger zone where the workup is more complex. Figuring out what is wrong is much more challenging for
It's so
physicians.
hard on an infant, my God.
So little babies, best idea is to go to the emergency department. However, you can just call your pediatrician. They do it all the time, and they can advise you on whether is this an emergency department thing or is this something which can be seen that can be seen in the office.
Okay.
Once you get older, 2-3-year-old's got a fever, 103, but he's running around and drinking juice and playing with his friends. A little Tylenol, a little Motrin, a little time, and that should be fine.
You can usually tell when they're older. If they're acting lethargic, then that's something to be worried about. But if they're, being a kid, they're probably fine. How about a broken bone? Because I do know I've heard before that urgent cares can handle a broken arm. Is that right?
It depends on how crooked it is. to be
Been there,
fair.
sadly. I know what you're talking about.
So, especially in orthopedic urgent care, they're going to most of the time be able to look at it, do some basic setting, and then get you the appropriate follow-up. However, if it's bent to a degree that it needs to be reduced, it needs to be straightened right now, then they could do it, but they couldn't do it with sedation. And if it's my crooked arm, I'd kind of like to be asleep when they're.
I had a compound fracture once, which means, for those who don't know, means the bone comes through the skin.
Yes.
Yeah, and it was bad. It was bad, and yeah, sedation was key.
Yes.
All right. How about an allergic reaction?
So it depends on the allergic reaction. A minor allergic reaction, maybe like some little itchy bumps, no big deal. That could certainly be taken care of in urgent care. However, if you have any allergic reaction that involves your airway or your breathing, meaning you've got an allergic reaction and it's hard to breathe, you've got an allergic reaction and your tongue is big, that is very, very serious. And you might go straight from thinking urgent care to straight to an ambulance.
Oh, wow. Okay. How about eating? I love my Anita writes some of these. This is great. Yeah. Eating something you shouldn't, a.k.a. a dishwasher tab. A Tide Pod is really what she's saying.
I do, yeah. Please don't do that.
Oh, gosh, no. They are colorful, but ugh.
Yes. So if a child has ingested something and they're immediately showing symptoms, meaning they ate some pills, ate something off the ground, drank something under the dishwasher, and they're sick, meaning they're repeated vomiting, they're confused, emergency room, emergency room, emergency room.
Okay.
However, if they ate something and you're looking at them, they seem just fine, still might need the emergency room, but call poison control. You just Google poison control, and they have advanced toxicology training, and they can tell you, oh gosh, yeah, that can go at home, or they can say call an ambulance, or they can say just go in and check in an emergency department. Poison control is your friend, and it's free.
Okay. Snakebite. Ugh, God, just the thought of it makes me shiver.
So if you are an expert herpetologist and identify that snake, and you are absolutely certain that snake is not a venomous snake, then obviously it can be handled at home. However, if you're not, just come in, see an emergency department, have us take a look at it.
Yeah.
You can take a picture of the snake. Please do not bring the snake to us.
Has that ever happened?
Oh, yes. People have brought live snakes.
Live snakes?
Live snakes, yes.
Oh, my God. How did they even get it in the... I don't know. That's a story for another day. Go ahead.
On a much more serious note, oftentimes people will cut the head off with a shovel.
Yeah.
The head still bites and poisons you. And so people have picked up the head. The head is still alive, and all the poison's in the head. So please don't touch the head.
What?
Yeah.
You've seen someone get bit by a head of a snake that's off the... Oh, my
Absolutely.
God.
Yes. Please don't touch it. Take a picture. We love pictures. We don't want to see the snake.
Okay. Oh, well, let's just move on to the next gross one. Spider bite.
Spider bite. So I've been talking about North Carolina here,
right?
But in North Carolina, the major spider that's going to cause problem is a black widow.
Yes.
And it's going to be painful. The child is going to be very sick. It hurts so terribly bad. This is
adults too, not just children.
Absolutely.
Yeah.
Children and adults. You get bit by a black widow, you're going to be hurting so bad, you're going to go no matter what.
Oh, it's that bad.
It's awful. There are rarely some brown recluses and other spiders that can cause really nasty lesions on your skin, which, although rare, could be taken care of most of the time at an urgent care. But if you've got a lesion and you're worried about it, then urgent care or ER. It's just going to depend on how big it is.
Okay. So, you're going to go to the ER regardless with the black widow bite. Is it true, just since I got you,
Yes.
that you can only get the antivenom for a black widow once?
Oh, wow.
Because my stepfather got bit by one.
Yeah.
And he says if he ever gets bit by one again, he would die. I don't know if that's true.
That's not true.
Oh, good to know. Good
He's
to know.
not going to die if he
It's
gets bit
also
by
known
a black
he's
widow.
known to exaggerate also.
Yeah. So black widows have obviously poison that hurts. It causes your whole body to hurt, and can rarely cause some permanent medical problems, but most of the time it doesn't.
Okay.
Most of the time you can control the pain with morphine and Valium and IV fluids. That's all you need.
Oh, okay.
There is an antivenom. However, the antivenom, just like the poison, can cause allergic reactions,
Oh,
which
God.
can be life-threatening. So most of the time, we're not going to give you the antivenom. And that's not because we're mean. It's because we can control the pain with morphine and Valium.
And it won't
IV
kill you, it just
fluids, and
hurts.
it won't kill you.
Gotcha.
There's reports of really dangerous, life-threatening reactions to the antivenom. So it's one of those hard decisions in medicine where I have to ask myself, is the poison of the spider bite
Worth
worse?
it, yeah.
Or is the reaction to the antivenom worse?
Wow.
I wouldn't get antivenom twice, for sure.
Okay.
For a black widow spider bite.
Gotcha.
That's just me.
What about a dog bite?
Dog bite. So most dog bites, so a minor dog bite where, there's a little cut, but no big deal. Wash it out. You can go to urgent care, have them look at it, probably give you some antibiotics, especially if it's on the hand.
Okay.
Now, a dog bite where there's significant injury, so like a large dog that maybe broke some bones, maybe tore some tendons, that's obviously going to need the emergency room.
Yeah. And how about a wild animal encounter, maybe rabies kind of thing? Like,
Yeah.
how do you know? How do you know?
You ask all the difficult questions.
That's my job.
A wild animal. So, I don't know.
Like a coyote.
A coyote that comes up and bites you. That's strange, right? A coyote's a relatively little compared, 30, 40 pounds.
Right.
That shouldn't come up. They should be afraid of you and run away. And so if one ran up to you and bit you, that would make me think maybe the coyote was crazy, i.e. maybe the coyote had rabies.
Right.
And so I would go in and get a rabies shot for that.
Okay.
It's same with bats. Like bats are little bitty animals. If a bat just flies up and bites you, that bat is acting crazy.
Okay.
And so I would get a shot for that.
All right, great. Let's see. Ticks.
So in most of the time, a tick bite in North Carolina is going to be just fine. And so if you can gently remove it, ideally getting the head out, that's all you're going to need. If you start seeing signs of infection, like it hurts a lot, or very rarely a person's bit by a tick and they're acting really, really weak, then that should be something that should be taken to the emergency
When there's that
department.
bullseye thing you look out for too.
Exactly. So there's two different kinds of bullseyes. One of the bullseye lesion is a pretty harmless infection called the starry infection, where it probably just go away on its own. Maybe a little doxycycline.
If I saw any bullseye though, I'm heading to the ER. I'm sorry, I know about them.
You can.
Yeah.
You can. The urgent care can also get you the.
I mean the
antibiotics
urgent care. I
for
didn't
it.
mean the ER.
Okay.
I meant the urgent care.
Yeah.
Sorry.
It's not going to be a life-threatening run-in, and they're
Right.
going to do the same thing.
Okay. Poison ivy.
So poison ivy, that's going to be overwhelmingly urgent care, or even primary care.
Okay.
Poison ivy is maddeningly itchy. It's. I mean, I get it all the time, and I absolutely hate it.
You get it all the time. I don't want a lot of yard work.
A lot of
nowadays?
yard work,
Okay.
exactly. A lot of yard work, a lot of camping,
Gotcha.
a lot of running through the woods with my dog.
Oh, that's fun.
So, but yeah, any urgent care should be able to handle
Okay.
poison ivy.
All right, now we're going to get back into the wounds.
Sure.
A head wound that bleeds a lot.
Yeah, well, you've only got a limited supply of blood, and so if that blood is bleeding and you can't stop it, then absolutely.
Okay.
even minor cuts on the head can bleed a significant amount, and especially if you can't control it with pressure, it's got to come in.
Okay. How about a sports injury, like a concussion style thing?
Oh, a concussion.
Yeah. How do you know if you have one? Like, and if you have one, does that mean you need to go to the ER?
Well, again, you never ask any easy questions. So finding out whether you have a concussion or not. Concussion is a clinical diagnosis, and what I mean by that, concussion just means hit in the head and the brain acted funny. So if I fall down, hit my head, and I say, "Where am I?" That's a concussion. If I get hit in the head and I'm just dizzy, then that's a concussion. If I get hit in the head and jump back up and like, "Wow, that hurt," but my brain's working normally, that's not a concussion. But I'm going to make things more difficult for you.
Okay.
You can also have bleeding on the brain.
Oh.
Now, that's profoundly serious and is almost always accompanied by a concussion.
Okay.
But, I'd say it's 99% accompanied by a concussion.
Okay.
And so my big question is not, do you have a concussion or not? My question as emergency physician is, do you have bleeding on the brain or not?
And is there anything aside from a concussion that would tell you that?
Well, most concussions don't bleed, but the thing that I worry about in children or adults is repeated vomiting.
Gotcha.
So, a little kid hits their head, cries, and throws up, no big deal. An adult who hits their head and starts throwing up, especially 2 times, 3 times,
That's something
that
to be worried
worries
about.
me.
Okay.
Abnormal sleepiness, I don't like that. If I see a person abnormally sleepy after hitting their head, then they're going to the ER.
Yeah, good to know.
The urgent care in North Carolina, urgent care does not have a CT scanner.
Gotcha.
And if your doctor examines you and examines abnormal, you need a CT scan. Now, if the doctor examines you and everything's fine, you can skip that.
Got it. Okay.
Skip a little radiation.
Good to know. All right. How about fever with vomiting?
Well, that by itself, that just fever with vomiting doesn't mean you have to go to the emergency room. We're assuming you're more than 3 or 4 months old,
right?
But it's real common to throw up with
a fever.
Yeah, you feel terrible.
And so at what point would you get to a point where it's not normal? Is really what I'm asking.
Well, it's not a number. If you're 105 and you've got a sore throat and you take some Tylenol and it goes down to 101, you feel better, then generally that's not going to be a problem.
Even in an adult, 105 fever.
By itself. Now, the truth is, an adult with 105, that's pretty rare. So they're probably going to have other things like terrible back pain or hurting when they pee or an uncontrolled headache. Those are things which are going to say, I might need to go to the emergency room.
Gotcha.
If it's just the fever, you take a little medicine, the fever goes down, most of the time you're going to be just fine.
Okay. I feel like we're talking to hypochondriacs here because I can't imagine how many people come to the ER that you're just like, really, this is easily treated.
Yes, but I've also been a parent, and I've woke up and looked at the baby in the middle of the night with a fever of 104.5, and they look terrible.
Yeah.
And I'm nervous. I'm scared. I love my baby, and I don't know that they're going to be better.
Yeah,
so what I do in real life is I give them some Tylenol, I start a stopwatch, and I wait. You better get better. If you don't get better in 45 minutes, we're going.
Wow.
That's what I do.
Okay, that's good advice too. All right, how about a dislocated shoulder or other joint?
I can't speak for all the urgent cares, but I bet they're going to want you to come to the emergency room.
Okay.
There are ways to relocate a shoulder without sedation, which I actually like to do, but
is it slamming it against the wall like you see in the movies?
It is not that technique. That does work, but it also breaks the little chip of bone off. So please don't do that.
Good to know.
most dislocated joints are going to need reduction. They're going to need sedation.
Yeah.
And other things can be wrong. You can pinch nerves. You can break bones and things like that. So that's going to be in the emergency room.
Gotcha. Sprained ankle.
Sprained ankle. A sprained ankle where the ankle is not crooked. Mm-hmm. Almost all urgent cares will be able to take care of that, especially in orthopedic urgent care. Now, if you look at it and the foot is pointed the wrong direction, that is for the emergency room.
Yeah.
You're not going to make that mistake, though.
Yeah, no, that's, definitely. You probably get an ambulance at that point. This one happened to my brother on Thanksgiving, and I'm going to kind of mix these two up. Well, maybe I shouldn't. We'll start before we go to the next one. Abdominal pain, which is so generic.
You just picked an entire specialty.
Really?
I can do this if we have about 48 hours.
I mean, I can only imagine,
Yeah.
like how many people come in like my stomach hurts.
Right.
What does that mean?
It's worse than you think it is. Well, what I mean by that is up to half the time when you come in for an abdominal pain, we don't know what the abdominal pain is even when you leave. Because if it's gas, if it's maybe a little constipation, if it's a little irritable bowel, there's not like a magical test for those.
Wish there was.
What we do in the emergency room is we check to see, is it a life-threatening condition?
Right.
So I want to know, is it appendicitis? Is it an affected gallbladder? Is it a swollen blood vessel which is about to rupture? Those are the things that I'm worried about, in addition to another 200 things.
Wow.
If it's not those, then I say, well, you got abdominal pain. It's like saying, well, you got a headache.
Yeah.
It's frustrating for
Yeah.
patients. For me, I feel good because I'm like, oh, it's nothing bad. Patients are often frustrated because, well, I want to know why my stomach hurts.
Yeah,
And-
you're also like, and I want it to go away. Yeah.
Well, that's true too.
But I could see why I after I'm a mom, like, and trying to diagnose my kid with simple words like, my stomach hurts. How does it hurt? It just hurts. Like,
Yeah.
how am I supposed to help you? I don't know how you guys do it.
Well, children take it up one more time because children will say, my stomach hurts, when what they mean is I'm nauseated.
Right.
And so
Well, believe me,
you
I've
would be
met that.
amazed at how many children I get better from their abdominal pain by just giving them something for nausea. And they're like, oh, it's better because they know something's wrong. but
Right.
They can't put
And
the
this
words
is their
to it.
tummy. Okay, how about appendix pain? What side is your appendix on?
Your appendix is on the right side.
Okay.
It's on the right lower side. It usually kind of starts out around, the pain starts out around your belly button, and then
Okay.
it slowly over hours to sometimes a day will drift into the right lower side of your abdomen.
Okay, and how do you know it's something serious?
It is a diagnostic challenge for me.
I see.
It's work for me. I can only give you the general.
Okay.
Generally, a person who has appendicitis won't want to eat, and when it's bad, they'll start throwing up.
I see.
Generally, they won't want to jump up and down. They won't want any sort of
Movement.
If I see a person who's walking around, grabbing their stomach, walking back and forth, that could be serious. It's not likely appendicitis. More likely like a kidney stone.
Gotcha.
I do not like to see a still child with belly pain. Child is just staying still. That concerns me.
Right.
It makes me think something's in there's hurting so bad he doesn't want to move.
Right. Speaking of kidney stones, my brother had one at Thanksgiving, and he just disappeared for a while, and he was upstairs writhing in pain. So he went to the emergency room, but did he need to? Could he have gone to the ER or the urgent care?
Gosh, it depends. Was he absolutely certain it was a kidney stone?
No, he had no idea what it was.
Okay, well, if you're not sure,
Yeah.
because there's other things that cause terrible pain.
Right.
What the emergency department has quick access to IV access, and we have IV pain medicines. We also have a CT scanner, and God forbid that CT scanner shows something bad.
Right.
Then we have surgeons and people
You've got everybody. You've got the arsenal.
Thing.
Yeah.
You know, if you've had 3 kidney stones before, it's exactly like your last kidney stone. You maybe just need some pain medications. Sometimes the urgent care will be able to
But most times, if you're experiencing pain that severe, just go to the emergency room.
Most of the time, and especially if you've tried the normal things, you've tried your Motrin, you've tried your
Right.
Tylenol, you've tried getting positions, you've tried an ice pack,
Right.
and it's not working.
Yeah.
Then that's the time for the emergency
Okay,
room.
we have just a few more. You've been very, very fun to go through all these with me, and the print is smaller on these. Okay, how about dizziness or vertigo, or maybe blurred vision?
Oh, that is a hard one. That is a very, very hard one, and I'm gonna have to divert kind of to my previous answer.
Okay,
Meaning, you've had vertigo before, you've got it again. It happens when you moved your head and then it completely goes away. You know,
Right.
this is like your normal vertigo. Then and it got better when you took your meclizine or whatever medicine you had in the past. That seems like something that could go to an urgent care.
okay,
However, I've never had this before. This is much worse than is normal. Something else strange is going on.
Right.
Like my vision's a little off or my speech is a little off. Then I'm going all the way to, what if it's a stroke?
Right.
Then, and if there's 2% suspicion it's a stroke, and urgent care is going to correctly say, get out of here and go to the emergency room.
Strokes are nothing to be messed with. I know that from personal experience also, sadly. How about if you know you have cysts?
Ovarian cysts.
Correct. If you know you have an ovarian cyst and if it ruptures, does that mean you're going to the emergency room?
Generally, no.
Okay.
No. Ovarian cysts, unfortunately, if you've had one, you're probably going to have another one.
Oh.
And they form, they grow, they ache, they rupture sometimes, and it hurts. Easily 95% of the time. What are we going to do? We're going to give you some Motrin, maybe give you some IV fluids, and
it's very expensive Motrin.
It is. It is. That's going to be hundreds of dollars at least.
Yeah.
Now, rarely, and I have seen this a handful of times in my career, but I've seen more than 50,000 patients. So,
wow.
Rarely an ovarian cyst will rupture and bleed a lot. If it bleeds a lot, person will get pale. They might start passing out. They might have difficulty breathing. That's going to be ER
For sure.
all day long.
But your instinct's going to tell you that.
Yeah.
Hopefully.
Yeah. If you've had it before, you've got it again. I'm sorry, but that's something that can be handled at home most of the time.
Yeah.
Now there is one more thing. If you've got a big ovarian cyst, sometimes an ovarian cyst can twist. It's called a torsion. That's agonizingly painful and usually accompanied by vomiting.
Yeah, because of the pain.
That's a surgical emergency. You can lose the ovary from that.
Oh, okay.
So when you're like, wow, this is so much worse than normal, then you're going to need an advanced ultrasound.
Okay. We have 3 more, just so you know. Shortness of breath.
Shortness of breath. That's going to obviously depend on your age and the severity.
Okay.
And the reason it's happening. If you've got asthma, you've got a cold, you're short of breath, you take your albuterol, gets some better, a little worse, that kind of thing. Well, you can handle that at home. You're like, wow, these nebulizers aren't working as well. This seems worse than normal. You can go to the urgent care and they can give you like continuous albuterol and maybe get you tuned up like that. If it's much worse than normal, then wow, this kid or this adult is desperate to breathe, then that needs to be in the emergency room.
Okay.
Now notice what I said is you already know the diagnosis. What if it's me?
Right, out of nowhere.
I'm a man of a certain age, and suddenly I get short of breath. That doesn't make any sense. I don't have asthma. I don't have a cold.
Yeah.
If I'm just like, I just can't breathe, 10 out of 10 times I'm going to go to the emergency room because there's no reason for me to be short of breath.
Got it.
Then I want to know, is it a blood clot in the lung? Is it, I don't know, some crazy pneumonia? Am I having a heart attack? Those are the kind of things that I would want to know.
All right. Near drowning after CPR.
So 100% of the time, if you need mouth-to-mouth or chest compressions, even if the person comes back to life and everyone cheers, you need to go to the emergency room.
Okay.
And I'm going to take it one step further, which is if a child is, I love kids. I only do 50% kids. I do 50% adults too. I don't know why I'm being so mean to adults.
Yeah.
But if a person is submerged underwater, you take them out and they need mouth-to-mouth, you have to take them to the emergency room because their lungs have been damaged from the water and they might get worse in the next 6 hours.
Oh.
Now, so any alteration in mental status or confusion after a choking or submersion injury has to be checked out in the emergency room.
Oh, I didn't know that.
Now, kid's wrestling with his brother and gets sputters and gags and maybe cries a little bit. That by itself doesn't need to go to the emergency room. But if then the kid starts wheezing, well, that doesn't make sense. He doesn't have asthma. If he starts wheezing, let's go to the emergency room and get checked out.
Could be like a fallen lung or something.
Yeah, or it could be rarely a collapsed lung. But if you suck enough chlorine into your lungs, then you can get, it's kind of It's almost like a chemical pneumonia.
Oh, wow.
Where over the next 6 hours, you might get worsening shortness of breath.
Okay.
Most of the time you won't. Most of the time you hang out, get a hug and a kiss in a few hours, and then you're back home. But if it gets worse, sometimes we need to do more advanced techniques.
Wow. All right, last one. After you have to use an EpiPen.
Yeah. So if you thought your allergic reaction was so severe that you needed the EpiPen, then I want to see you in the emergency room.
You don't want to wait to the next day to see your allergist?
I do not.
Okay.
No. I recommend, and the allergists recommend, that you use an EpiPen if you have problems with breathing or problems with blood pressure, like you've got an allergic reaction, you pass out,
Okay.
Low blood pressure, or swelling inside the mouth.
Okay.
The Epi is a magnificent drug. It works so well for somewhere between 3 and 15 minutes. So after that time, you might have a rebound.
Oh, wow.
Usually you don't.
But you might.
Sometimes you do.
Yeah.
And so you might not get a second chance because once that tongue swells up and fills your mouth, I can't put an airway in there anymore because it's full.
Oh, wow.
And so if you're using an EpiPen, then I want you to come into the emergency room.
Wow. I am blown away by your breadth of knowledge.
Thank you.
That's like, and I've never even really thought about I feel like we've only scratched the surface of the stuff that could come into the ER.
Oh, just the surface.
Good God. Well, thank you for what you do, first of all, and thanks for clearing this up for us today.
Hey, I appreciate it. It's a pleasure being here.
I am still in shock about how well-versed this man is in emergency medicine. I mean, it is what we want from our emergency doctors, but still, he had a lot of knowledge. If you have an idea for an episode or maybe a question that you need answered, or maybe you just want to say hi or maybe comment on something you've heard, we would love for you to get in touch. Send us a message on Instagram, Sarah Has Questions. We hope to never see you in the ER or the emergency room, but we're glad that we had a chance to figure out which one makes sense for what situation. Be well, and I'll see you next time.